Welcome back to The Race. I'm Chris Stewart. Healthcare workers are seeing a growing number of resources to help them deal with this pandemic. And as Alicia Nieves shows us, being on the front lines takes both a physical and emotional toll.
When this all first started, we knew things were starting to pick up in Seattle and New York, and we felt it coming down our way.
Working for 2 Jefferson Health hospitals in South Jersey, Dr. Jose Nieves has been a critical care physician on the front lines. In the beginning, he felt fortunate because his hospital system had a chance to gather enough PPE gear, create a plan, and brace for it. But when the surge actually started in one of his hospitals,
It was pretty terrifying. A lot of the stuff we had prepped and talked about, was, I wouldn't say thrown out the door, but it was a lot of rushed implementation of a lot of stuff we've never done before.
physicians like him struggled to save lives and learn about the virus at the same time.
The people that were at home were just researching, trying to throw data at the people that were in, and when you were in shift and they were out, they were doing the same thing.
Despite all their efforts, there were days when they couldn't save everyone. For Dr. Nieves and his team, a loss of a pregnant mother and her unborn child was the toughest.
Having that traumatic event occur at such an already high stressful level, the staff really had to be kind of gathered around and supported because, people were in tears. It was devastating.
On top of that, he also couldn't go home and get a much-needed comforting hug from his girlfriend for fear of exposing her to the virus.
That to me started to kind of hammer it home that there was no real break from this.
Over the past 3 months, have you walked into the hospital and looked around and just seen how much of a toll this pandemic has taken on yourself and your colleagues?
Yeah, the toll, at some points for some people was that they didn't think that they can do this anymore.
Jefferson Health leaders also seeing the toll the pandemic was taking on staff stepped in, leading town halls for workers to vent and offering counseling. Other hospital systems around the country are now doing the same.
Doctors that you saw last year are not going to be the same doctors mentally and emotionally that you're going to see, in the coming years.
And he knows that firsthand. For The Race, I'm Alicia Nieves.
More to come on The Race. Stick with us.